All right, we're getting, hello, Leslie. And Sandy is on with us today. All right.
I don't have anybody on.
Oh, that's weird. We're trying to figure some stuff out here, guys. We're doing our first 3-person broadcast on StreamYard. So we think we got it figured out. So I'm sure you'll let us know, especially Sandy will let us know if we are not getting it figured out right.
Leave it to Sandy. We love you.
Yeah. So we're going to give just a couple more minutes. The numbers are going up here, so before we get started. But just want to start off talking a little bit about why we're doing this particular webinar. And it has a lot to do with just the fact that, quite frankly, when we look at comorbidities with this whole COVID thing, cardiovascular disease is very high on that list. So whether it's blood pressure problems, heart disease, we know obesity and diabetes, which both are strongly tied with heart disease as well, that these things are really important. And it's one of the major reasons why people are either having really good outcomes or, unfortunately, not so good outcomes. Hey, Tracy. And so I just wanted to start off tonight and just kind of just hope that everybody's doing great. We're doing good things. We're going to be giving you guys some great tidbits on things that are going to not only help heart health, but they also are very important with all of those other chronic diseases that we know about. So our hey, Fiona. And so as we get kicking off here, I want to just thank Dr. Zach and Dr. Troy for coming on, and we're all going to kind of be chiming in at different times here with a hope of keeping our thing just under 3 hours. So we should have everybody off by at least 9:30. No, just kidding. It won't take that long. But if I set it up for 9:30, then if we get done at 7:30, everybody thinks we're good guys because we did fast. So anyways, I want to get started tonight, and let me switch over and get my screen to the PowerPoint. Oops, got to actually click on the PowerPoint in order for that to happen. Okay, so our webinar is on Heart Strong, and it's really, like we talked about, it's about having people be able to see and be able to get the best function, best systemic changes in their heart, because a strong heart, well, our little tagline says you can't beat a healthy heart, and that's literally true on both sides of the portion. So our mission tonight is basically we want to empower longer, healthier lives through chiropractic care and in the integration of our 5 essentials. So as our solution to this, we're going to basically be going through the entire 5 essential process with you and how these specific changes and how they work to help us with heart disease. So how amazing is our heart? Our heart literally is beating for us day and night. We don't ever have to think about it. It's pumping thousands of gallons of blood through our body every day. I read a report one time that said the amount of energy that the heart puts out would be able to lift a completely full Greyhound bus 6 inches off the ground. There's enough power and force in what your heart does every day to do that. So kind of a cool thing, and just the idea of what the heart does for us, how it moves blood, it brings nutrients and oxygen to the tissues so that we can stay healthy. So when it comes to heart disease, what do you guys think? So most of our patients will know this, but where does it land in the cause of death rankings? So although there's debate out there, and unfortunately the cancer people are fighting sometimes with the heart disease people to try to pretend like more people are dying of cancer. And unfortunately that happens because that's where funding goes. Whoever's the number one cause of death gets more funding from it. But the current statistics say that heart disease, in fact, is the number one killer in our country. And then, like we talked about, it's also one of the number one comorbidities with poor outcomes when it comes to the coronavirus. And so tonight, our goal is to really talk about these 9 risk factors. So we got some very important risk factors for cardiovascular disease. One of them is heart rate variability. And so what does that mean? Well, heart rate variability is how much your heartbeat has the ability to vary itself given different stresses and different actions that are going on in the body. And there's tons of evidence that supports that when we have low heart rate variability, that we actually have increased risk of cardiovascular disease, increased risk for potentials of heart attack. Blood pressure, I don't think we need to dive into too deep just yet because everybody understands what that is. We're also going to be talking about cholesterol and kind of debunking a lot of the myths out there about cholesterol. Smoking, I don't think we need to explain that one a lot. If you are still smoking and you think that it's good for you, then we have a problem. Most people that at least smoke understand that there's consequences to it. Obesity is another huge one, and that one was with the COVID-19 as well, as far as risk factors. Diabetes, which obesity and diabetes obviously are both increasing risk factors for cardiovascular disease. Chronic inflammation, sedentary lifestyle, and then uncontrolled stress and depression, those types of things. So kind of the emotional world. And so first thing I want to just cover is what is cholesterol. So understand that cholesterol is just a transport molecule. So its job is to the HDL and LDL is to transport cholesterol to or from the liver. Okay, so when what's called bad cholesterol, that's what stores cholesterol in the bloodstream. So if we have damage, though, we have to understand why it's happening. The first thing I think everybody needs to understand is that your body doesn't have a vendetta against you. So it's not trying to clog your arteries just to try to take you out quicker. So if there's a reason why cholesterol would be leaving the liver, it's because there's a purpose. So it has to get into the blood, and it has to go, and it's typically our number one repair tissue. So as we're finding out more and more about cholesterol, which we're going to dive a little bit deeper, understand that really there's no such thing as good and bad. There's just either going away or going towards the liver. Now, what they do call good cholesterol, that's the HDL, and that's what allows the body to rid itself of the body type of cholesterol. So it'll get it out of the arteries. It helps excrete the excess stuff out of the body. So that's why it's called the good cholesterol. So interesting, though, that an analysis of cholesterol values in 1,700 patients with atherosclerotic disease revealed no definite correlation between serum cholesterol levels and the nature and extent of the atherosclerotic disease. So isn't that interesting? We've all been told that cholesterol is this evil tissue, that it's what's taking everybody out, that the body has a vendetta against you, that it's trying to do this. And the truth is that when it comes to true heart disease, they haven't been able to say that is actually true, okay? So skipping and moving into the HDL cholesterol. So why is that important? Well, the primary reason, like we initially talked about, was to bring stuff to away out of the body and bring it back to the liver for recycling or excretion. And so it's very important for us to have good HDL cholesterol numbers. As a matter of fact, people always ask, so if my numbers are a little bit off, how do I raise my HDL cholesterol? Well, here's some great tidbits for that. So consume olive oil. Olive oil has been shown to do that. Follow a low carb ketogenic type diet. Okay. Exercise regularly has been shown to raise HDL. Add coconut oil to your diet. Stop smoking, lose weight, choose purple produce. So the components that are in the purple things actually have key ingredients that actually help to raise HDL cholesterol. Eat fatty fish often. So these unfortunately aren't the really typically, like it's salmon and the cold water fishes that usually have more omega-3s and better. And then the final thing is to avoid trans fats. Trans fats are toxic fats. They increase inflammation, and that's going to have a negative impact on HDL. So when we look at LDL particles, really what's important with LDL is the particle size. So they've determined that the size of the particle actually has more to do with outcomes of heart disease or any of these things than the number itself. So when we have a lot of large particles, and you can kind of see, like with these cup examples, that the number could be the same, but we have a whole bunch of them in that in the cup on the right. And so we wanted to look at the differences between those particle sizes, and you can actually request that when you're getting your blood work. So a lot of people just get the general lipid panel, which will give you the basics, but this actually is a way for us to really dive in deep and get into more important numbers. So a lot of you guys remember Tim Russett, who died suddenly of a heart attack, and that was his issues. So he had a lot of those really small LDL particles, which created more significant danger for him, which is unfortunately what led to his heart attack and his passing. And so again, we have less risk and lower risk if we have less particles than if we have more particles. And so when we talk about causes of high LDLs, a lot of the things that we talked about what raises good HDLs, it's kind of the opposite of those things of what makes bad cholesterol. So the LDL cholesterol it's made to fix inflammation. It's a repair tissue. If you were to injure yourself, the body will raise LDL cholesterol to go help with repair in the body as well. So that's one of the reasons why even just doing snapshots of typical blood chemistry profile isn't always the best answer for what somebody's cholesterol issues are at. Okay, so eating a lot of trans fats, eating a lot of, especially, so if we're eating animal products, especially conventionally raised animal products, has a way more significant impact on LDL cholesterol. So we always teach our patients, what are we supposed to eat? We're supposed to eat grass-fed beef and, free range chicken and wild caught fish, that kind of stuff, because the more men mess with it, the more toxic the meat becomes, and it becomes more of an inflammatory factor in the body. And so, the mindset that so many people have in our society is that I'll just pop Lipitor or whatever, Crestor, whatever you want to call it, and I'll eat whatever I want, okay? Because we can artificially lower these numbers. And if you're artificially lowering it, but we're still doing bad things, do you really feel like that's going to help you out in the long run? Okay. Hopefully you're getting to an understanding that no, just because I take a pill to make a number a certain thing doesn't mean that I'm actually healthy. Okay. So here's a couple of great examples. So here's a couple of studies that were done. So this was a big study. It was 5,600 men aged 45 to 73 and 900 or about 1,000 women. And they did a study on them, and they wanted to look at if they take lovastatin or a placebo, what are the outcomes of them dying of heart problems? So here's what the answers told us. They said total mortality at 5 years was 2.4% in the lovastatin group and 2.3% with the placebo. So what does that mean? It means that more people died that were taking the cholesterol drug than people who were taking the placebo. Okay, so if this was really this kind of life-saving thing that was so amazing and all that stuff, we should have saw 2.3% in the placebo group and 1% or 1.3% in the test group. But the test group actually had more. Okay, and so there was another one with 5,800 patients, 50% of them women, went through all of the histories, and they did a 3.2-year follow-up. So this was interesting because stroke death was higher in the group that was taking the medication, 0.5% versus 0.8. So the ones on the left are placebo. The ones on the right are with the drug. Okay. When they looked at heart disease was higher in the placebo group than in the treatment group. And then when we look at cancer was higher in the treatment group and lower in the placebo group. So what did it all mean? What it all mean is, why did that last study show that there was, only a slight worsening? It's because even if it had the effect to try to help a little bit with the cardiovascular disease, the fact that it increases cancer risk and it increases stroke risk, those benefits the consequences outweigh the benefits. And if we add up all those numbers, we actually have more people dying on the drug than that were on the placebo. Okay. So we have to understand that, if we're going to look at benefits, the benefits have to outweigh the consequences in order for this to be something that we should want to dive into and really look at. And I mean, that's my opinion, obviously, but hopefully people see it that way as well. All right. So when we look at your cholesterol numbers, one of the things that the more current research is really showing is that your HD level is more indicative of heart protection. So if you had a cholesterol that was a bit high, but your HDLs were really high, there's really no consequences to that because the HDL levels, those protective things are going to be stronger than what the negatives would be with the LDL. So they've also shown that your HDL to cholesterol ratio is more important than what the LDL is. So if your HDLs are really low and your LDLs are high, that's when we get into the danger zone. Okay. So the total non-HDL cholesterol also has more importance than LDL alone. Okay. So these are all numbers that you can look at on your blood labs, and you can look at those ratios and you can say, okay, am I protective because my HD levels are high? Even if my total cholesterol was maybe like 230 or something, but my HDLs were 75, and I looked at my ratio and I looked at the total, that number versus the LDL number, I would have a better understanding of why my heart is protected from that. And also one of the reasons why cholesterol, those just general cholesterol numbers, have not shown to be indicative of actually helping people live longer. All right, so now we're going to transition into blood pressure. So blood pressure is a major problem in the United States, and it has to do with a lot of those cofactors that we talked about earlier with obesity and sedentary lifestyle and poor diet choices, stuff like that. And so they call it the silent killer because until blood pressure gets pretty high, most people aren't experiencing any kind of symptoms. When your blood pressure does get high, there's some people that will get, dizziness. They'll kind of get a ringing in the ears, may get headaches from it. Like they'll start having some almost like neurological type symptoms because the blood pressure is really high and basically the blood is not getting where it needs to go in enough time, and then eventually symptoms will show up. So it is a good idea to monitor blood pressure. We would never tell somebody like, hey, throw your blood pressure cuff away. It's a stupid instrument. That's not a true statement at all. There is good reason to monitor those things. But if we start to see it starting to change, the difference is what are we going to do to help it? We're going to go down the road of a medication, or are we going to look at what's causing the blood pressure to get high and then try to change those things? And I hope that that's the path that people want to take. So stages of blood pressure. So we've all kind of known that the numbers of 120 over 80 have kind of been the normal. And so they have changed these and they changed them back. So the old numbers were these ones. And then I don't know if you guys remember, but about 2 years ago, the American Heart Association and the cardiology people said, hey, the first thing we need to understand is that it's somewhat normal for people's cholesterol to go higher as they age because our arteries lose a little bit of elasticity. So as long as it's not jumping up into these crazy numbers in the 180s and that kind of stuff, then maybe it's kind of a normal progression of aging. So we shouldn't be quite as alarmed. Well, unfortunately, over that 2-year period after they released that data, guess what happened? Drug sales for blood pressure drugs, they go up or down? They went way down. And so through lobbying, they rescinded those and said, let's go back to the old numbers. The old numbers are better. And again, no real clinical evidence to show why that is, other than it just sold more drugs, unfortunately. So these numbers are the current guidelines. We've got to show them to you because that's what the medical guidelines are. But I always, tell people like you're the ultimate decision maker when it comes to what is too high for me to where I think I would have to do a medication because I've tried lifestyle things. Maybe I've tried this and it's not working, or maybe I needed to go on it for a short term because it spiked up to 200 over 140. That's not a safe place to be. So I take a medication to get it down with a goal, figuring out why it went so high, what can I do to help myself so that I can eventually come off of that medication. Because the truth is, people, if we really are being honest, people that are on blood pressure pills, when did your doctor tell you we're going to come off of them? Never, right? Like never are you coming off of them. And that's a problem because we get a lot of patients that take their health seriously. As a result, their blood pressure starts to go down. They go visit their doctor and say, hey, my blood pressure is doing better. I'd like to come off this medication. They start to wean them off their medication and they don't have blood pressure medication anymore. And it's because we got to the cause of the problem. So the good news is even though it's the number one cause of death in our country, you also need to know that it's also considered the top preventable cause of death. Meaning if we make the changes, if we dig in and we start talking about, implement the things we're talking about tonight, we can actually make these changes and we can actually turn what was going to be the number one killer and we can prevent it. Okay. So change the statistics, and prevention is the key. So we really need to look at the things that we need to be aware of, the things we need to be focusing on. Unfortunately, a lot of people they're focused on things that they can't control. Like, you can't control your heredity, but you can control epigenetics. So epigenetics is your body's ability to express your genes. If we make good decisions, it'll express good genes and it'll repress bad ones. But if we make bad decisions, then our bad genes wake up and our good genes get turned off. So the good news is we have the ability, we have the power within us to make decisions, to make changes. All right, so that's kind of the background information, guys, to kind of get us kicked off and get us going in the right direction. Now we're going to start jumping into how can we help people prevent heart disease with our 5 essentials. So core chiropractic. So I remember having many conversations with patients, and they were like, we were talking, why are you guys talking about heart health and chiropractic? What does it have to do with it? Does it, I have back pain or I have neck pain. What does this have to do with it? And the truth of it is that it has a lot to do with it. We're going to cover some of that stuff. So just understand that, your brain controls all that function in your body. And in order for it to communicate with the body, it does so through your brain, your spinal cord, and your peripheral nerves. So, I use Christopher Reeves as an example all the time to people. Everybody remembers our old Superman guy. But when he fell off his horse, he broke his neck right up here at the very top of his neck, C2. And it compressed his cord. And luckily it happened in the United States, where our amazing emergency crisis medical teams were able to save his life. But everybody remembers, after that trauma, how did he function? Okay. So he was in a wheelchair, couldn't drive, arm and legs were paralyzed. A lot of people didn't recognize that he was actually on a ventilator. And people don't know that he had to have a pacemaker put into his heart. And they fed him through a tube through his nose, and they had to massage his colon every day to make him go to the bathroom. And so they were doing all of these outside stimulation things. But my question to everybody was, when he fell off his horse, did he injure his heart, lungs, stomach, intestines, all that stuff? And the answer is no. What he did is he compressed the spinal cord, which then cut the brain's ability to talk to the body off. And it wasn't that his heart didn't ever beat or his lungs didn't ever breathe, but it would not be, there was no rhythm. There was no ability for it to, you think I'm Italian or something, the way I move my hands. But it wasn't any of those things. He just simply, the body couldn't communicate. And so they had to start beating his heart for him so that he could adapt. So, and his breath could adapt based on his blood oxygen and all those things, because the body wouldn't know how to do that without it. So 6 ways chiropractic helps with cardiovascular disease. So number 1, these are all, we're going to go over the sightings for these at the end here. But number 1, our first one is that lowers blood pressure. So studies show a significant improvement in blood pressure when chiropractors adjust the top vertebra in the neck, called the atlas. It lowered the airplane bone. That's right. And so, it actually lowered cholesterol better than 2 medications given in combination. Okay. And so that's an important thing for people to understand, like why could that happen? You unmuted.
Sorry.
Okay. And so then we look at the number 2. So it improves nerve function of the heart. So this is called the autonomic tone, and it has an impact on heart, lungs, gastrointestinal tract, kidneys, bladder, sex organs, just about every part of your body. So we know that, we have the sympathetic nervous system, the parasympathetic nervous system. And when the sympathetic system is overpowering, we're in that fight or flight state, that has a very negative impact on that. And there's been shown that through chiropractic, we can actually help balance the somatic or the autonomic nervous system. Okay. Number 3 here, decreases blood markers of inflammation. So the more inflammation that we have in our body, the greater risk that we have of cardiovascular disease, and quite frankly, every other chronic disease. So cancer, diabetes, all of those, the chronic inflammation. And we've actually been able to show through chiropractic adjustments that it actually lowers those inflammatory markers in the body. Next one is it improves heart rate variability. So if you remember, our number 1 thing that we talked about on our 9 things to help was heart rate variability. So the more your heart rate bounces around, the longer you will live. Many patients with severe heart issues have a significant problem with decreased heart variability. And we've actually been able to prove, again, with clinical research, that doing adjustments actually increases that heart rate variability, which will allow the heart to be able to be better adapted to the situations. Another big one is decreases chest pain. So there's literally millions of hospital visits for chest pain. And, those oftentimes are compressed nerves in the upper back, rib pain, costochondritis, those types of things, which are because we have biomechanical issues there. So huge reason why people get referred to chiropractors is often that chest pain is musculoskeletal in nature as well. And then the last one is it improves lung function. So chiropractic care has been proven effective in patients with asthma and emphysema. And poor lung function is going to lead to heart problems, because if lung function is down, then the heart has to work harder in order for it to get blood, the oxygen, the nutrients where it needs to go. And so lung function is really important there. Okay. These are the each one of those. So our 6 things: the Journal of Hypertension, Journal of Chiropractic Medicine, Journal of Manipulative and Physiological Therapeutics. So all of the different journal articles that had those in there, so that people can see the references for those. All right. So now we're going to, I'm going to sign off for a moment, and I'm going to bring on Dr. Zach so that he can take it and get us through the nutrition portion and all of the important things we need to do so that we can make sure that you are healing and functioning at top level.
All right, guys. So as we know, heart disease is the #1 killer right now. And so I'm just going to be giving you guys some nutritional tips and advice to start implementing into your, your daily activities, but also just your daily snacks or any daily meals and things like that. We want to start changing some new things just so that we can help out with the obesity and the diabetes and the chronic inflammation as well. Okay, so looking at these 2 sides here, which side do we want to eat? I know you guys are thinking the right side, but honestly, we got to go to the left side. Okay. We know, this is talking about like our advanced plan or CARB plan that's in the Align Your Health book. Those ones are great ways to get started, to start changing your current diet or your current eating habits right now. So some of the things you want to start to avoid, as you can see over there in that list, a lot of that's like trans fatty acids. The trans fats actually come from like cookies and crackers, cakes, cinnamon rolls, pies, microwave foods, frozen pizza, fast food places. There's a lot of fast food places out there, like say McDonald's, Burger King, Taco Bell, not very good places. Some of the places that, like I like to go to would be like Chipotle, even Qdoba. Yeah, so Qdoba is also another good place to go to. Rubio's, along with like sandwich shops, like Jersey Mike's or
Just don't say Subway.
Yeah, no Subway, no. Jimmy John's, yeah, Jimmy John's. But what you want to do is not get the bread. You want to get the unwich, which is what they do is they wrap it up in lettuce. Those are the better options to get. And so you want to make sure stay away from sweets and sugars. Some of the things over on the eat side, we can see there, we want to make sure that we have healthy fats. We know healthy fats are good for us. Nuts, coconut oils, butters, olive oil, avocados. Some fruits that are low in sugar would be like green apples, berries, blueberries, raspberries, and also some great vegetables to start incorporating is broccoli, spinach, kale, cauliflower, and asparagus. Those are some really good things to start doing. So if you look over on the right side, the avoid side, all of that stuff there increases your omega-6s, which are bad when they're out of balance, when they're super high. When that happens, actually will increase your inflammatory markers or inflammation throughout your body as well, which then leads to obesity and poor lifestyle and things like that. So omega-3 fatty acids. So every single cell in the human body is actually dependent on omega-3s for them to be active and actually do their jobs. And we have a lot of cells in our body. We're made up of over 37 trillion cells. So we got to make sure we're feeding it what our cells need, because that's what we're made up of, majority. So omega-3 fatty acids are actually an anti-inflammatory. I was reading some things, and they say a minimum of 5,000 milligrams a day. But actually, the best is to be between 2,000 to 4,000 milligrams a day for a healthy adult. And if you're unhealthy, and I'm sure majority of people, if you know you're unhealthy, that's going to be over 5,000 milligrams a day is what you'll need to kind of combat the stuff you've done to yourself over the years of eating that crappy food. Also, so research has actually talked about how omega-3 fatty acids can actually help to reduce the risk of cardiovascular disease and high blood pressure and the bad cholesterol, which is the LDL. So having higher consumption of that, and a lot of times, we actually need to have like 2 fish meals a day to the bare minimum. But actually, we truly need about 4 to 5 fish meals a day, which I know usually doesn't happen. Yeah, sorry, I meant a week. Yeah, that's a lot. That's a lot of fish in one day. Yeah, no, take that back, in a week. So the best thing to do is you can supplement with omega-3 fatty acids. Some good sources from natural food that you can get the omega-3s from are like avocados, eggs, wild-caught fish that come from like salmon, sardines, anchovies, trout, oysters, holy mackerel. Just kidding, just mackerel, tuna, and mussels. So those are some great fish things that you want to incorporate. And some other ones are like flaxseed and hemp seeds. Those are also great with omega-3 fatty acids. Some nuts you can start incorporating are almonds, macadamians, hazelnut, and walnuts. The cool thing about the omega-3s is not does it only help out your heart, but it can help out with anxiety, depression, eye health, and brain health during the pregnancy in the first beginning years of childhood as well. Okay, so our cardiovascular wellness bundle. So we've got 2 supplements here, garlic and parsley oil and broccoli blend. So with both of these blends here, what's up, Tracy? This combination wellness blend or bundle we have, it's designed for anyone who is looking for support for a healthy heart, which helps to increase circulation and blood flow throughout the body. And in turn of that, it helps to reduce the inflammation markers and actually will boost up your energy overall, which is everybody needs energy. Where we use energy all day, every single day. So it helps with that. The garlic and parsley, there was actually a study on it, and it actually can lower your bad cholesterol, which is your LDL, by 12%. So that's pretty significant just by taking the garlic and parsley oil. I know eating just fresh garlic is much better for you, but if you can't eat, a bunch of cloves of garlic, which is not usually fun for anyone around you. I mean, even with your own self, smelling that garlic breath is not usually fun. As long as with the broccoli blend, for one of the tablets that we have in here, you have to eat like, I think it's like 3/4 of a cup of broccoli just for one of those tablets. So it's a lot easier to take the one tablet than eat a bunch of broccoli, but at the same time, you'll get better results if you eat broccoli. The next bundle that we have here, this is going to be our cholesterol balance bundle. So with the cholesterol balance bundle, having high, good HDL, which is the good cholesterol, and then low, bad cholesterol, which is the LDL, reduces the risk of heart disease and enhances your overall health. So what you want to do is you want to target your cholesterol levels with natural supplements that may help you achieve optimal levels. And with this cholesterol bundle, this is what will help you with that. It helps with balancing out the blood lipids as well as your healthy cholesterol, which is the good HDLs, and it decreases your inflammation throughout the body. So with the red yeast rice here, one of the studies talked about how it can actually lower your LDL levels by 21%. So that's pretty huge. So taking this one supplement, the black cumin seed oil can help with hypertension, along with digestive issues, pain, and then if you have any skin problems, it can also help with that. I know this is all about heart, but it can help with those other things as well. Then lastly, the plant sterols. It actually lowers your bad cholesterol, which is the LDL again, between 7 to 12%. So that's a pretty good little, whole food supplement bundle there to help decrease your cholesterol versus taking Lipitor or those medications that are chemically trying to do it for you, which isn't a good idea. And all right, to our last bundle here, this is talk about our high blood pressure bundle. So we have the BP support, optimal K2 and potassium, and then the L-arginine. So high blood pressure increases the risk of heart disease and stroke. And so this high blood pressure bundle is excellent bundle for people looking to have a target heart rate or blood pressure, which will help to increase your overall cardiovascular health. And what this does, so the BP support, so there's a combo of ingredients with this blood pressure support that's actually been shown to lower your high blood pressure versus chemically trying to do it. The next one here, the optimal K2 and potassium, it decreases your systolic and diastolic numbers. So the systolic is the top number, the diastolic is the bottom number. And by doing that, it helps to bring down your high blood pressure down to an optimal normal level there. And then the last one here is the L-arginine. It actually improves your blood flow throughout the body. And with that, it's going to help with the circulation, obviously, increase the blood vessels so we get proper blood throughout the entire body. And in that right there, it also helps to increase our immune system. And who doesn't want a good, strong, healthy immune system? Because guess what? Stronger people are harder to kill.
That's
I
right.
love that saying. So, okay, so with some of these resources that we got going on here, we've created some stuff here. So we have our blood pressure and heart rate tracking sheet. And so with this, we're having them sign in to our Facebook thing or not?
Yeah.
We're going to explain a little bit more on that there. So with this heart rate and blood pressure tracking sheet, it's an interactive way to just track your blood pressure throughout the week and keep up monitoring that so we can kind of see where you're at and if there's any things that we can help you with during that time. There's a cardiovascular performance perspective on this here. It's a great resource because it actually will explain to you our 5 essential approach to getting a better cardiovascular system. And it gives you a list of the different supplementations that are great for cardiovascular health as well. All right, and here goes Dr. Troy, our exercise guru.
I don't know if guru is the right word, but can you guys hear me okay?
Yeah.
Perfect. Hey guys, glad you're all here with us. So I do get to go over the exercise portion for you. I'm pretty excited about that. I'm not going to go into so much detail of what specific exercises you need to do, but when I was looking up information for exercise in general and how it really affects the cardiovascular system, there are tons of studies out there. And basically all these studies are suggesting, well, most people know exercise is great for you. It's good for your heart. It's good for literally anything you can think of, exercise is going to help you. Specifically, since we're talking about heart, we've had studies that show that it increases your HDL, which is that good cholesterol, right? It decreases the LDL. It also is going to decrease your risk factor for strokes and surgeries from cardiovascular problems because you're actually doing great things for your heart and then the blood vessels, which means that you're going to have a healthier heart and blood vessels. So the likelihood of you having surgeries on those things goes way down. On top of that, like most people know, when you exercise consistently, you also will get a reduction in your weight. The added benefit of that is, hey, you're losing weight, which is great news. But when you have less weight, you typically are going to have a lower blood pressure. And again, if we can lower and regulate our blood pressure correctly, that means the heart doesn't have to work as hard, which means that your body's actually going to work a heck of a lot better for you because you're not taxing that heart. And remember, that thing is going on every minute of every day, all the time. So we want to do everything that we can to give it the best ability to perform at its greatest. Another thing that we're seeing with the exercises, they've shown that it actually will increase vascular wall function by releasing nitric oxide at better rates. And if you guys are doing the Max T3 workouts, I talk about this a lot. But you're basically going to be increasing your nitric oxide, which is going to allow more oxygen to get through the blood vessels and perforate the rest of your body. So you're actually going to be boosting your immune system and your cardiovascular system doing that. We got an adjustment over here. That right there is also really good for helping your body out. But from an exercise standpoint, you're also going to be increasing your muscle function as well as the strength of your muscles. And like we found with just exercises in general, hey, if we're doing better and we're improving our health through exercise, we're actually lowering our chances of deaths, right? So our death rate, they did a study that showed that people who regularly exercise, so consistently, and we'll talk about that, it actually lowers their death rate by 20 to 25%. Which is pretty freaking awesome. I mean, that's that's awesome. There's not a lot of medications that'll do that for you. So it's super important to make sure you're exercising. Now, what the studies don't tell you is like which exercise is the best exercise. Now, what they all say, general, is like you want to do exercise. You want to be moving. You want to make sure that you're sweating. It should be something that is getting your heart rate up, and that's the main focus. So whatever exercise you decide to do, just make sure that it's an actual workout and you're actually going to be increasing your heart rate. You're also going to be increasing and you're going to be feeling that sweat. You're going to be feeling like you're doing something, and I think that's the biggest thing. What they recommend is at least 30 minutes of moderate exercise, and moderate exercise can be as small as like a brisk walk. They even said like golfing. If you're a consistent golfer and you're walking on the golf course, that's going to give you some exercise. Now, if you're doing that on a daily basis, you're certainly going to have a lot more moderate exercise being done, but certainly just staying active and staying moving is super important for you. One of the biggest things is, don't do the exercise that you don't want to do, right? So I feel like people have a hard time doing exercises when it's like, hey, I watch my friends do CrossFit and they look like they're loving it, right? And then I go and I do CrossFit and it sucks. I hate doing it. Well, if you hate doing it and it sucks for you, you're probably not going to do it. And therefore, it's not going to give you the benefit that you want, because if every single day you have to wake up and you have to challenge yourself just to wake up and go do the exercise, you're not going to be doing it to the full extent that you should be. So, pick an exercise that you love to do, something that you really enjoy. I just got done talking to a patient. She emailed me earlier today and said that, she loves getting outside and doing yard work and moving things. And that's awesome. Like if you love doing yard work, you love getting outside, you're getting the sunlight, you're moving, you're staying active, you're doing great things for your body. And you're really going to lower down those risk factors for those cardiovascular disease. Like we talked about earlier, the cool thing with the exercise too is pretty much all of those 9 risk factors can be taken care of by making sure you're getting good exercise routine. Now, that's not to say that that's all you have to do, but, obesity, a sedentary lifestyle, high inflammation, all those things decrease when you're doing great exercise. So, just get out there and get moving. And do that as often as you can. You're going to be doing amazing things for yourself. And you're not going to end up where the majority of the country is going, which is with heart disease and heart attacks and things like that. So keep that in mind. Again, that moderate exercise, that's 30 minutes of moderate exercise, preferably every single day, but at least 4 or 5 days a week would be a really good amount for you to maintain a healthy lifestyle with your exercise. So that's what we want. And we do exercise here. Obviously, that's Max T3. Now I do Max T3 here in the office. We've been doing live events every Wednesday evening at 6:30 and Saturday morning at 9:30. You're more than welcome to tune in for that. It's awesome. Once we get the okay to come back here in general, we'll be doing that here in the office, and you're more than welcome to come to that. That is a great way to improve your cardiovascular health as well as health of other organs in your body. And it's fun, it's fast, it's quick. And it's exciting. So, join us for that. It's awesome. Check us out on Facebook Live while we're all sequestered. So awesome. Okay. So, after the exercise, another big thing is minimizing toxins. Now, it is one of our essentials, and we talk about that a lot here. Now, the reality is it's impossible to get rid of toxins. That's why it says minimize and not eliminate. Right now, the truth is the air you breathe in, the water you're drinking, a lot of the foods that we're taking in, I mean, toxins are everywhere. And because we cannot eliminate them, we have to do our best to minimize and limit the amount of toxic exposure that comes into our body at any period of time. Now, the great thing, and what should be empowering for you, is like this is the most preventable disease that we have. Right? So that means you have control over fixing it more than anybody else. So that should be empowering information, because these are the steps that you can do to fix those problems for yourself, and that's exciting. So, minimizing toxins, one of the biggest things for the toxins is smoking, right? Like everybody understands that. I don't need to hit that super hard, but like if you're smoking, stop doing it. If you're not smoking, don't start doing it. Pretty easy. Now, what we find is like smoking is obviously detrimental to your health from a lot of different aspects. When it comes to cardiovascular health, there's over 4,000 chemicals just in smoking a cigarette, which is insane to me because it's supposed to be tobacco. So I don't know where they get the other 3,099. You know, it's insane. But that's what's going on. So every time you're doing that, you're getting 4,000 toxins into your body, into your lungs, really damaging your tissues. And what we're finding is it actually starts to harden the arteries. It starts to thicken the walls of the arteries, which again, when we're talking about cardiovascular health, that starts increasing your blood pressure. If your vascular system is hard and rigid, is not supple, well, now your body has to have a lot harder time to get blood everywhere. Now it's going to do it because that's what your body is designed to do. But now your heart has to work twice as hard, 3-4 times as hard, just to get that same amount of blood pumping throughout your body. So we certainly don't want to be taxing our body at all. Now, the cool thing about smoking, or stopping smoking for that matter, not really anything cool about smoking, but you know what they find is that if you stop smoking for just 1 year, you are lowering your heart attack risk significantly. And they say by 5 years, if you stop smoking consistently for 5 years, you almost have the same risk factor as somebody who never started smoking. So what that tells you is your body is incredible. It can take the amount of damage, and we're talking people that have been smoking for 40 years. You know, it can take that amount of damage and heal. And in 5 years period of time, you can be doing amazing things for yourself, and you are lowering your heart risk and really risk for any other thing that you can think of, you know. So make sure that if you are smoking, really start stopping that. You know, Dr. Zach and them talked about nutrition and those aspects, and you know, the toxins that are coming in your food from the pesticides and herbicides. We really want to be limiting our intake of those. So we talk about having the clean 15 or the dirty dozen list, which is, you know, making sure that you're getting your fruits and vegetables from organic sources if they're really high on that dirty dozen list, which comes from the environmentalworkinggroup.org. So EWG.org, they print out a list and you guys can go check it out. And it literally will tell you how many pesticides and herbicides you're finding in your fruits and vegetables. So check that one out so you can really limit your toxic load overall. And I think that's really like the biggest thing. Like I said, we can't eliminate it. So all we could do is really lower it down as much as possible. But yeah, that smoking, guys, that one's huge. So, you know, get through that one.
Perfect.
Yep.
All right. So a couple of questions. Whoa. Wow. A couple of questions. Yeah. A couple of questions that have come in. First one somebody had asked, does the garlic blend give you garlic breath and all that kind of stuff? You know, and there's really not a simple solution, because really what it comes down to is, like, my voice is like dragging for some reason. Is that better?
Yeah.
Okay. So, as we're the garlic issue, it's not really a garlic issue, meaning like if your digestion is good and all that stuff, then people don't get that. Now, if you're having reflux or you have some underlying health conditions, those people may get a little bit of that garlic flavor back or taste back. And then we had another question about, you know, how long do we have to take it? And that really depends on where we're starting at. So there isn't a magic number that says if I just took it for 30 days, all my problems are gone. It's really going to depend like on some of the tracking things that we've done. So what's your blood pressure like? What's your heart rate like? You know, what do we know about your cholesterol levels, all that kind of stuff. And that would be the stronger indicators of, does somebody need to do this for 1 month or 3 months or 6 months or a year? All of those things could be possibilities based on what those numbers are telling us. And then the final thing is Dr. Troy was talking about that EWG.org. Most smartphones will also have the EWG app. So that's a really good app to download, because then as you're in the store, you have quick access to it. They actually even have, I don't know if it still does. It used to have a scanner where you could actually scan a label and it would tell you if there's known chemicals or stuff that you shouldn't have in your body when you scan the label. So a great resource to try to minimize those toxins. Okay. Now, as we get kind of moving on to mindset, you know, much of what we've been talking about so far, hopefully you understand, has to do with mindset. What do we understand about heart disease? What are the risk factors? What are the things that I can take control of? And that's having a positive mindset towards how we're going to do this. Now, we also have to understand that mindset has to, with the mental side of it, is understanding, if I make this decision, what are some of the consequences for that? Okay, so you know, I tell people all the time, I like cookies and donuts just like, you know, other people like cookies and donuts. What? I know, it's hard to believe. But I choose to not eat cookies and donuts often because I understand the consequences of it. I'm eating trans fats. I'm eating a lot of sugar. I'm inflaming my body. And even when you sometimes, and people that have gone without sugar for a while and they've really done a good job, when they get sugar back into the diet, how do they feel? Horrible, right? I mean, they're like, oh my gosh, I had no idea how much of an impact this was having on me. So those are all mindset triggers that allows us, and and how do we keep a strong mind with it? We talk a lot about getting a strong big why. Like why do you want to not have heart disease? Because I want to be able to play with my grandkids. I want to be able to hike and climb a 14, or I want to be able to go ride bikes. I want to be on a cruise ship when I'm 80 years old with my spouse, holding hands and still enjoying life. Like find something that you're passionate about and really dig into that. Okay. Yeah. So the other side of that is sleep. So when you talk and you poll people, it's quite alarming the number of people that get poor sleep quality in our society. They're sleeping very little time, or they're up 4 times a night. And there's so many things. We've done so many workshops on brain health and memory health and all these things. And you can't cheat sleep. Okay, sleep is when your body repairs itself. It's when it regenerates itself. It's when it cleans out the brain. It's when it allows the body to do the repair for the damage that you've done for that day. And so it's very important for people to understand why quality sleep is so important. There's a couple of factors that really make good sleep. One, you should be sleeping in a dark room. So some people have, their TV on, they have their, night lights on, they have, like I know I had a TV in my room, and it had, like, when it was off, it had this like fluorescent blue light on it. And I'm like, what the heck, So we put black tape over it so that we could cover the light up, right? And my wife gives me a hard time because I sleep with those little like goggle blinders on at night. But I want total darkness, because there's evidence and research that shows that when you're in total darkness, it allows better melatonin release. It allows better hormone changes in your body. So in that pitch black room, if you can't get your room dark like that, then those little blinder things are a great simple thing. We got ours on Amazon, and I think it was buy one, get one free for $10 or something. And so it's something that's a real simple fix for that. So that way, if you don't want to cover up all the lights or whatever, you're still sleeping in total darkness. So quality of sleep is such an important thing. It helps to balance that sympathetic, parasympathetic tone issues, all of those things. And when we're not getting that sleep, unfortunately, it's having negative consequences on us. So, for the first part of as we're moving through this is, for patients, our patients that are here, they understand. And I think a lot of them would give you great testament to the changes that have happened in their life as a result of addressing underlying neurological imbalances and postural issues. But there's people watching that aren't patients, whether they're in our office. I know we've got people watching from Nevada and all over because of our friend networks on Facebook. And so it doesn't matter about coming to our office, but it's like go in and get an assessment done so that we can actually find out, is there neurological complications? Are there things that are inhibiting your body's ability to express health the way that you want it to? Chances are, unfortunately, there is. Okay. I can't tell you, I've been doing this for 20 years now, and there's not too many times that people come in and I'm like, wow, I didn't find a single thing going on with you. Okay. Subluxation and these misalignments are real. They happen because of traumas, acute traumas, chronic repetitive things like sitting in front of desks. It's been a pretty, on the phone. It's been a pretty significant thing to see, like with this whole coronavirus thing, as patients have had to go home to work. They used to complain about their workstations at work and how they were hoping they would be better ergonomically compared. And then they get home, and now they're like at the kitchen table, or they're, and they're like, holy moly, I'll never complain about my work environment again, because now I know what really poor ergonomics are. And, and they're in tremendous amounts of increased pain and tension and stuff like that because of the stress that's being put into their body. So we want to help people overcome and combat that. And that's one of the most important things that you can do for your health long-term. And so, make an appointment, whether if you're local here and you're not a patient, call our office, or, I forgot to put the phone number on there. So our office phone number is 720-747-5333. You can even call right now. Krista's here. If you know it's something that you need, or you have a family member that needs to get an assessment, we've got an amazing thing going for that. As we're coming out of the coronavirus issues, we're just trying to bless everybody that's made it through. And so what we're doing is we're offering a 3-day package for people. So the first day would include a complete examination, thorough finding out exactly, looking at posture, finding out exactly what's going on. The second day would include your first adjustment, so the actual treatment part of it that's going to help your body start healing and functioning better. And then the third day, which is what we call our x-ray review time, or whatever the test that we've done. And we'll sit down with you, we'll go through these tests, we'll show you where the problems are at, we'll understand more of what's going on. And guys, we're doing all of that for $97. Okay. Yeah, that's a surprise. Great surprise face, Dr. Zach. So just so you know, like, and many of our patients will even attest to the fact that when they came in, it could have been, $70 for this, $120 for that. And so very easily it's $250 to $300 to get through that process. But we're doing it today just for the, for $97. And so Dr. Troy's putting the phone number up there. So it's 720-747-5333. Feel free to call in if you need to make an appointment for that, or if you have a loved one. And like you said, you can also go to maxliving.com. If you don't live here, type in your zip code and do a search to find an office that's close to you. The good thing about our network is we literally have hundreds of offices all over the United States. As long as you don't live in town of 7 people in North Dakota, we probably have somebody who's close by. And if you can't find somebody in your area, please reach out to us. We will help you find somebody who will do a great job for you. All right, so we're going to transition into our action steps here. So what's next for people is the question. And I want to bring Dr. Zach back so that he can kind of go through what we're going to be doing to try to help our patients not only get the information, but how to implement it and be successful with it.
All right, you guys. So this is our cardiovascular challenge program. And so what we're going to be doing here is that blood pressure and tracking heart rate sheet. So we're going to make, throughout the week, you're going to be at home doing your blood pressure, checking your heart rate every day, writing it down on that sheet there. The next, that right there, just that sheet alone, the value is $20. So the next one here is our cardiovascular performance perspective. We talked about that a little bit earlier ago in the nutrition section. This also talks about all of the 5 essentials that we do in the office. And so that value right there is $20. So we're up to $40.
You're good at math.
Thank you. Thank you. And then shop with a doc. I know this is one of our best events that we do with a lot of our practice members in the office. And what we will be doing is we will be taking you on a shopping tour to go through, reading labels, let you know what are good for us, what's bad for us. Stay around the outside of the grocery store and kind of give you some tips when you go grocery shopping to make it faster for you. And then the value of that shopping class is $89. Now we have our cardiovascular bundles. The cardiovascular bundles here. So we already talked about some of those there, the wellness bundle, the high blood pressure bundle, along with the cholesterol balance bundle. Those range from $96 to $97, all the way up to $136. So everything total so far. The next thing here, we got our clinic Facebook group.
Sorry, I turned it back for you.
Okay, so so far with all of those things, the blood pressure tracking sheet, the cardiovascular perspective, the shop with the doc, and one of the bundles, whichever one you want, comes between $225 and up to $265. So our clinic Facebook group, what you want to do is you're going to go into Facebook. You're going to, or even on here right now, actually what you're going to do now is you're just going to log in onto our chat thing here, put I want heart health. And when you do that, what we're going to do is we're going to send you a link through our Revive Tribe. Our Revive Tribe is our Facebook group, special Facebook group for this cardiovascular challenge. With that challenge group, we're going to be posting things throughout the week, some tips, some things to be doing at home, also in the office and things like that. That value is $89, so it comes out to a total of between $314 up to $354. And then you'll have a nutrition strategy session. You'll have a 20-minute nutrition session with one of the docs. to really find out what it's going to be. What are your steps? What are you looking for, so we can help you down that path for cardiovascular health? That value is $147. So all of those things, the blood pressure tracking sheet, the cardiovascular performance, the shop with the doc, the cardiovascular bundles, whichever one you want to choose, the Facebook group with a bunch of cool things that we're going to post in there, and then the nutrition class that we'll be having with one of the docs, all of that comes out to $461 up to $501, depending on which bundle you want to get. But just wait. So if it helped you reduce the risk of cardiovascular disease, do you think it'd be worth it? I sure hope so. Gave you the exact action steps and resources so that you don't have to waste time trying to figure it out yourself and then get frustrated and just give up. Would it be worth it? Yes. Gave you personal accountability group, which is huge with any kind of challenge you're trying to do, along with some personal coaching to help you throughout the challenge along the way. Would that be worth it? Totally worth it. But so all of this stuff is only $159.97 up to $199.97. So you guys, whichever one you guys want, what you're going to do is down below, you're going to post in there that you want to be a part of this Facebook group with us. And then whichever bundle you want to get signed up, you're going to do is you're going to call our office right now, 720-747-5333. Let them know which bundle you want, and we can get you signed up on that challenge.
All right, guys. So our upcoming opportunities that we have, just to give, we're still under lockdown orders in Arapahoe County here locally. And so it's been, it's limited a lot of things that we can be doing, obviously. And so we're hoping that on the 8th of May is when we're supposed to get released from that. We hope that follow through is true. The numbers are flattening and all of those things are improving. So we're really hoping that the 8th is going to be the end of that lockdown. And once the lockdown is off, we've got a lot of really cool things planned as kind of a re-kickoff, getting back to health and life. We know there's still going to be some restrictions on groups and all that stuff. So don't worry. We're not going to just, throw caution to the wind and have 100 people come into the office, even though, that would be a fun time. But we've got a lot of cool things that are going to be coming out for that. And we've got like a Mother's Day coming up in May. I know a lot of the women are disappointed that I've already talked to, because we normally do our ladies pamper party over that Mother's Day weekend, where we come in and we treat you to foot baths and massages, and we make sugar scrubs and all of these different things. And so we're going to be doing a little different thing this year. We don't want to not do that. So we're going to kind of be doing more of a virtual based things and help you still give you some ingredients and and instructions on doing those things. It's not going to be obviously the same. You don't get the camaraderie and the fun times that we've had. It's by far the most popular event we do every year. We have to limit to 50 people all the time, and the sign up sheet is literally like full within 2 days of putting it out. So we're going to have to do that a little differently this year because of the circumstances. But I want to let you know that we've been active on it. If you haven't clicked on and watched our Strong People Are Harder to Kill videos that I did last week, there's some great videos that really goes through and kind of hits our 5 essentials on how it's really applied to this coronavirus thing, because that's what we've learned, guys, is that if you're healthy and if you're building health and if you're doing the right things in your body, then your body's ready for whatever comes to it. If you think coronavirus is going to be the last virus thing that comes to us, it's not. There's going to be new things, and especially when we find out more that they can keep making stuff in the labs. It's like making the stuff in the labs, that would probably help us out a little bit too, but that's not going to stop. And so we're going to have future things down the road and all this kind of stuff. And all I know is that we got one extreme where people are not even realizing they got sick. They got exposed to it. They didn't have a single symptom. They go get their blood tested and they're like, wow, you have antibodies for coronavirus. And then we have people on the opposite end of the spectrum that get sick and very rapidly go into bad places and need, emergency ICU care. And unfortunately, guys, like when we're looking at it, the studies show and the stats show that 90% of people that go on ventilators don't come off. They're going to end up passing away. And so the number one thing that they're seeing is the obesity, the cardiovascular disease. Those are the risk factors that are increasing the likelihood that you're going to be that person who has the challenge. Okay. So we got to take this for what it is. What good is coming out of this? Well, hopefully for all of you, the good that's coming out of this is time to reflect and say, hey, where am I at? Am I where I want to be health-wise? What things can I do? What changes can I make that are going to allow me to start to make those changes? Okay. And so when we're looking at those core things, guys, the 5 essentials literally is the answer to pretty much every health issue out there, because there's no way that anybody can tell me that if they ate better and ate healthy food, they started exercising, they reduced subluxation and increased their nervous system capacity, they had a positive attitude, had strong mindset, and then they minimized toxic exposure. Like, what are the chances that 6 months from now, you're going to be worse off? I literally think it's 0. Like, there's no chance you could be worse off. And you're going to be 6 months older. So it's not that you're getting younger, although you'll feel younger, but you're chronologically not getting younger. But you have the control, guys. And you have to understand that every decision we make every day is setting us up for tomorrow. So if and when the next outbreak happens, where do you want to be? Do you want to be the person that has confidence in their body to know that they're going to overcome this thing, that they don't have to be scared? Or do you want to be the person who's living in fear constantly because what if? What if I got it? What if I'm the person that's going to go down the bad road? And there's no way to say 100%, obviously, that you wouldn't go down the bad road. But I don't think there's a single person that would disagree with the idea that if you're strong, healthy, and moving in the right direction, that you're increasing your outcome potential. And that's really what it's all about. So I really thank everybody for joining us tonight. I hope you got some great information. Our challenge thing that we've got going on, we're going to be doing that over these next few weeks. So again, reach out for our patients. When you come in, you can join that. We'll be doing signups for the rest of this week for patients that want to go through that. And just, like Dr. Zach said, that accountability, the support network, all of those things. Every time we get challenged, when you have a support network around you, it's a whole lot easier to make good decisions. So that's it for me. You guys have anything else to say?
No, love you guys.
Love you all. Glad you joined us.
Well done.
We're still live.